Wyvern Ward is a high dependency rehabilitation service for men with 16 beds. In addition, we have Wyvern Court, which are 3 flatlets that are larger and that have their own kitchen and living area, that are for service users who are stepping down to supported accommodation and to prepare those service users for supported accommodation, or to help patients who may have physical disability or mobility issues as the rooms are larger. Wyvern Ward and Wyvern Court is located in central Derby, very close to the train station, and local amenities are very close to the town centre of Derby, and we have shops and restaurants and everything you could want on Pride Park very close to hand.
So in terms of the typical diagnoses that service users on Wyvern present with, they include psychosis, personality disorder, a bipolar affective disorder. Those are the 3-4 common diagnoses we come across in our clinical practice. One of the key things that we do is manage risk, and that involves risk to self and risk to others. So keeping patients safe from themselves when they're poorly, and also keeping the community safe in situations when the patient or service user presents with a high risk is part of what we do.
The Wyvern Ward is a very homely environment. We have the service users like to engage in activities on the ward with different therapies with the staff and with peers. We have 2 floors of 8 bedrooms. In the communal areas, it consists of a dining area where staff will eat food with their service users. There's a lounge area with a TV, pool table and foosball table. We also have a group room, which we have our music sessions in there with guitar, keyboard and IT. Outdoor at Wyvern Ward, we have a courtyard, which consists of a nice grass area and a seating area with a table and chairs. We do like to play cricket out there as much as we can, and outdoor activities in the summer. We have a recovery college, which service users can go and attend. We also have a new fully furbished gym with all the state-of-the-art equipment, and ICT suite as well outside of the ward.
The multidisciplinary team on Wyvern and Wyvern Court has a consultant psychiatrist, a middle grade doctor, an occupational therapist, an occupational therapy assistant, a psychologist, a psychology assistant, a substance misuse worker, a social worker and an education worker as well.
So there are a range of activities provided for the service users on Wyvern Ward, and so they kind of fit into the categories of like self-care, leisure and also productivity. It looks at in-house based groups as well as external groups. So there are things like cooking skills, so teaching people to cook, or looking at the maintenance of them skills, looking at social groups like your kind of coffee morning style or any quizzes, looking at kind of life skills in various areas. So that could be aspects of budgeting, it could be looking at communication styles such as assertiveness. So one of the groups which we would provide is community skills. So within community skills, as OTs, we will be assessing individuals' abilities socially. So how do they function in the kind of, big wide world where it's busy? Are there any anxieties there of just being out in public? So we would look at engaging in various activities, which could be bowling, it could be the cinema, it could be going out for a meal, it could be looking at various research projects or even travel training. With each one of them activities, it provides its challenges that I guess us that aren't in services probably take for granted a little bit.
The substance misuse programme on Wyvern Ward, we offer one-to-one psychosocial interventions. So we'll offer an assessment and then we'll look at a pathway of treatment. We also offer a substance misuse group. That's weekly, and that will cover things like relapse prevention, education and information, smoking cessation and motivation and change. And then we will put together a plan of treatment for that individual. So it's very individual based.
The aim of Wyvern and Wyvern Court is to admit service users and assess their needs. Once their needs have been assessed, to decide which would be the correct recovery pathway for them. Take, in a risk-assessed way, a pathway out of the unit and try and move the service user onto either supported accommodation or their own flat.
But the pleasure and the joy in the job comes from seeing service users go from being quite poorly to then getting them to a stage where they've got loads of unescorted leave and they are in the community being discharged and hopefully not coming back into hospital. The goal that we tend to have, and what I tell my patients is, you're here for the slightly longer term compared to other wards and hospitals you've been in. But the purpose is to try and make this the last admission possible. We've had some significant success stories where we've had individuals who've come in through different levels of security, from medium secure to low secure and then to rehab, who've then been discharged into the community. I know from anecdotal evidence that these individuals who've been discharged 5, 6, 7, 8 years ago are still in the community and remain well.
It makes me feel happy, to be quite honest, to be able to see somebody change things where they can live a happy life. You know, I look at it more like that than our success, if that makes sense. It's more about the individual because they have to do the work.
I want to make a difference. I want to support people. I want to help people develop so they can function at their full potential. That to me is what recovery is about.